patient experience session offered a perspective from all different angles because the patient journey involves engagement from collaborative partners. So we had a speaker who was giving us the perspective about the hospitality that is involved with the patient experience. Then, of course, we had the role of the government and what the government needs to do to support international health travel. And of course, we had the perspective of the provider who is actually handling and working with the patient, not only delivering clinical services, but also the non-clinical services that are part of what is taking place when the patient is either in the hospital or in a clinic. And then finally, I think the true expert on the panel was our medical tourist, Rebecca, who shared with the audience what it was like to be a health traveler for not one, not two, but 3 different surgeries that she's had over the past 3 years. Absolutely. I not only advocate, I insist on it when I'm working with my clients. I believe that the patient experience is the new marketing. International health travelers expect that they will have quality clinical care. And what they anticipate is having a seamless end-to-end patient journey. And we have seen and heard from the speakers that in that aspect of the services, the service delivery has been at best sketchy, at worst non-existent. In terms of measuring, I would first of all suggest and recommend this to clients and work with clients through this, is first of all to map out the patient journey. And the journey simply means every single step in the process from initial contact through post-discharge follow-up. Where are the touch points involved with that process from the perspective of the patient? On top of that, I would layer what I call the patient experience. So on top of the patient journey, you have the patient experience. So for example, Rebecca, our medical traveler yesterday who was sharing her experience, talked about that when she returned home and she was feeling swollen and bruised and not seeing the benefits of the surgery that she had undertaken, she had a moment there of, oh my goodness, what have I done? Have I done the right thing? All of a sudden starting to second guess herself. And having the support of a terrific facilitator helped her through that moment of an unsurety. So yes, mapping the patient journey and then mapping the patient experience, the highs and lows associated with every step in the journey is just key to make sure that there are no gaps in the services that are being offered. Absolutely not. And my team will, of course, devastate the other team with our brilliant arguments. In terms of how I see the role of a facilitator changing over the past 15 years, I'd say initially facilitators were mom and pop sized businesses. They were small businesses who were focused solely on delivering services for individuals who were traveling for healthcare services. And now after 15 years, we can see an evolution in that role where the role of technology is playing a much larger part and serving other customers other than the individual. So now we're seeing as customers of facilitators, insurance companies, ministries of health, third-party administrators, and other large groups like that who are much more involved and interested in data collection, data analysis, and from their perspective, the role is secondary in terms of the patient journey and the patient experience. It would map out completely differently for those clients from the largest segment, the largest number of individuals who are traveling are still the travelers for dental care, cosmetic surgery, bariatric, IVF. These are still the services not covered by health insurance. These are individuals paying out of pocket who need assistance along the patient journey. And I think that's where we'll see the smaller facilitators being able to play an invaluable role in continuing to grow and evolve the sector. I'm very proud and pleased to be a regular attendant at IMTJ, both as a speaker. I've been a judge for the IMTJ Awards every year since they were initiated, and it's of great value. In terms of being a judge, I get to see what people are doing. I get to read their stories and learn about the wonderful innovations and the great things that organizations and individuals are doing for the international health traveler. And in terms of my own education, I love coming to listen and learn, to share whatever I can, my experiences with people. It's a wonderful exchange. It's a terrific group of people who are here not only to promote, but to also to give back. So I'm delighted to be here again and look forward to next year.